This is Sadie. She's a female Rat Terrier. When we saw her back in May of 2006 for the first time, and she was just a month before her 9th birthday. The owners do not live close, and Sadie had been to 2 other veterinarians before she came to us. They had diagnosed kidney failure and did not hold out much hope for Sadie to survive. This is a port that allows owners to give subcutaneous fluids at home quickly and easily. Sadie's owners were very dedicated to her care, and she made an amazing recovery. Here is Sadie 6 years later in 2012 at the age of 15. She's gone from 11.6 pounds when we first saw her back in 2006 to over 19 pounds. The reason her front leg is shaved is because we put a catheter there, and we've just completed one of the many routine teeth cleanings that we've done over the years on Sadie. Here are before and after pictures. We want to keep this tartar off her teeth because it is the leading cause of kidney disease in dogs and in cats as well. GIF tubes are used very commonly in cats so that owners can give subcutaneous fluids at home without the use of needles. This is Dolly, an 11-year-old spayed female domestic long-haired cat who weighs only 5 pounds. We've sedated her for this procedure, and you can see X marks the spot where we're going to place the GIF tube. We want to place the tube 2.5 to 3 inches from the base of the skull. Now I'm making an incision through the skin and into the subcutaneous tissue. Here is the GIF tube. It is a special, sterile, pliable plastic tube that has holes or fenestrations built into it to allow the fluid to escape the tube and flow into the subcutaneous tissue so it can be absorbed into the animal's bloodstream. And I'm placing a metal stylet to stiffen the tube to aid in placement. Now I'm introducing the tube through the incision that I made and working it through the subcutaneous tissue toward the cat's tail. You can see the fenestrations or holes in the tube that allow the fluid to flow out subcutaneously. We want to place the tube just off the dorsal midline on one side of the spine or the other. Once the tube is placed, we secure it with sutures at the 5 and 7 o'clock position on the caudal area of the cuff. Once these sutures are placed, we can then remove the stylet. And now we complete suturing the cuff all around to the skin. Then we place a special fitting called a microclave on the end of the GIF tube. This is a needleless interface that allows owners to attach an IV set without having to use needles and to keep the entire thing sterile. And here you can see the fluids are running quickly, subcutaneously, into Dolly. The owners will be able to do this painlessly and repeatedly at home so that Dolly can get diuresed with a sufficient amount of fluid to help her kidneys compensate. So there you have it, a GIF tube for subcutaneous administration of fluids at home. This is Jasper. He's a 12-year-old neutered male seal point, and he's been treated for advanced kidney disease with oral medication for the past 8 months. Today we're going to install a GIF tube so that the owner can give subcutaneous fluids at home. Once Jasper is anesthetized, we start by positioning him properly and then marking the spot where the GIF tube will be inserted. Here we're making a skin incision and opening the path with a hemostat. Now we are inserting the GIF tube with the stylet inside into the subcutaneous tissue just off the midline. Then we remove the stylet and suture the collar in place. Now the GIF tube is ready for fluid administration through the needleless port. You can see the fluid runs quickly and freely. It takes less than a minute to give 200 cc's of fluid to our patient. Then we fill this little red cap with disinfectant and put it over the port, ready for the next time. And now Jasper has come back to see us. It's been a month since we put this tube in originally. And this is the same day we've just connected the fluids to make sure that everything's still working smoothly. And you can see the fluids are still running quickly, and the process is completely painless for our patient. And here's Jasper with his owner, getting ready to go back home. He's a substantial cat and a handful, and we're happy that he continues to do very well in spite of his advanced kidney disease.